Chapter 2. Talking about diagnosis and treatment. Breaking the news. Explaining the diagnosis.
Often when parents talk with children, not just about cancer, but in general, we give them too much information. We forget that their worries are not the same as our worries. I think our tendency is to give them lots of detailed information when in fact it's more helpful to give them bite-sized information and wait for them to ask questions.
When I told the children that I'd been diagnosed with cancer, I'd kept the language really simple. So I just said, I've just been to the doctor has tested the lump and it is cancer. It's very small. I'd have to have an operation, some surgery, and then I'll have to have some follow-up treatment as well. But I didn't go into a great amount of detail.
Certainly, I think everybody in the family deserves to know what's going on, and children need to know the name of the disease, what type of cancer it is, and where in the body that cancer is, and importantly, that it is not their fault that mum or dad has cancer.
Much of what I explained to Simran was from a scientific perspective, just explaining about the cells and how the cells change, etc. How you have your normal cells and then some cells decide to do their own thing and don't quite do what the cells around them do, and they become malignant and they could become cancerous. So from that perspective, taking a very, not clinical, but a factual approach, was able to allow me to compartmentalize the emotional component as well as what was actually happening.
Remember, everyone in the family deserves to know what is going on. Use the word cancer. Tell children type of cancer, where in the body it is, that it is not their fault. Give bite-sized bits of information and wait for them to ask questions. Keep language simple. Managing symptoms and side effects.
The best way to answer children's questions is for parents to be well informed. So parents need to talk to their doctors about the likely side effects of their treatment and to also understand that they're unlikely to have every single side effect.
When the parent with cancer isn't feeling well, I think it's important for them to reflect on what is still okay for them. So I've had patients who use their post-chemotherapy time when they feel pretty awful to watch videos in bed or to have quiet time reading. I think also explaining why that's happening. I know that mummy looks okay, but she's very, very tired. And so working together to do those things that are still sustainable, telling the child it's not their fault that mummy can't play. It's not that mummy doesn't want to come to football, she's too sick. But next time you have football, she thinks she'll be able to come.
And the great thing was, by communicating it to the kids what was going on, they had a much better understanding of what my limitations were. And as a result, they weren't putting a huge amount of pressure on me to try and get to this or do that or those sorts of things. They knew that I wasn't as mobile as I could be, or I wasn't able to go outside and kick a footy and such like that.
If a parent is debilitated at times with symptoms, whether that's nausea, vomiting, and some other, really significant lethargy and other problems that can sometimes happen. Again, giving a child a simple explanation and helping that child know what they can do to help their parent. It's quite an important thing for children to feel that they can still be connected and still be close, even if a parent's limited at that time because of side effects in terms of what they can do. Sometimes effects of treatment, particularly changes in appearance, can be frightening for children. And acknowledging the child's reaction to that, saying, look, you might feel a bit scared at the moment because I'm going to look a bit different. That doesn't mean that anything, dreadful is happening, but that's the result of the treatment that I need to have.
The other thing that's worth pointing out is that when children are not managing in relation to the parents' side effects, it's a good idea to try and find out what it is about that side effect that's difficult for the child. Is it because the parent looks different and they feel self-conscious when mum or dad picks them up? Is it because they're worried that they will look the same or that they look different from their parent? What is it? One needs to sometimes be a little bit of a detective in trying to get to the bottom of what it is that a child is actually saying.
I know Sienna was she said, because we both had long hair, I had long dark hair and her hair's a bit lighter, but we both had long hair. And she said, she didn't like the idea that I was going to lose hair because then we'd be different. And I actually did have my hair cut between diagnosis and the first chemo session. I had my hair cut 2-3 times.
Yeah.
To
shorter.
sort of, so it wouldn't be as dramatic, but it was still dramatic.
Remember, the best way to answer questions is to be informed. You're unlikely to experience all side effects. Explain the positives and negatives about a medicine. For example, an anti-nausea pill that unfortunately makes the parent very sleepy. Adjust interaction time with children to accommodate side effects. Communicate the impact of side effects and possible frightening side effects to children. Ask children what it is about the side effects that worries them. Visits to the hospital.
In general, I think it's good for children to visit parents who are in hospital. I think even if they're very sick, because it allows them to understand that process and then to take account of it and to make adjustments. But some children are very sensitised. There are some children who become almost faint at the thought of someone being sick in hospital. So I think you can prepare them for that, you can orientate them and discuss it with them. For a child who doesn't really want to visit, maybe Skype, maybe Facebook, WhatsApp, all of those sorts of apps can be appropriate.
And sometimes it was about trying to find out exactly what she was upset about, because I remember very early on she showed some really great reluctance about going in to see Michael at hospital, and I was a bit stressed, thinking, how am I going to tell Michael that Carla doesn't want to come and see him? And then just talking through it, she was able to tell me, no, I want to see Dad, but I don't want to have to walk through the hallway. I don't want to see other people who are sick.
Again, this is about the sensitivity with which we do things. It's, I think, rare these days that children are not welcome into facilities. Obviously, if a parent's going through a distressing procedure or it's not appropriate, then that's fine. But for a child to be able to see that a parent has actually survived and is doing okay when they might have been very worried about a procedure is actually very helpful.
Anyway, so she saw that, and then they took her out into the control room while the treatment was actually happening, and they allowed her to talk to me on the microphone, which was really good. It was, I think it demystified any of it. It wasn't scary. There was, I wasn't panicked. She was quite calm about it. She coped with that really well.
As children get older, hospitals are so boring. They come and see Dad and say hello, and then they just want to sit on their phone or play with their iPad or whatever else. And I think you have to be flexible about that. Maybe short, sharp chunks are better than expecting them to spend an afternoon there, because that is not intuitive for a 10-year-old boy.
And we did things like bring board games into the hospital. We had Uno games, we had Jenga.
Yep.
Because, if I was going to see Michael, I wanted to be there for a couple of hours, but kids, it's boring, There's not anything to do in a hospital.
Yeah.
So it was about also making it an area that, okay, we're going to the hospital, but you can do this.
We can do things, that's
We can
correct.
do things in there.
That's
Bring a
right.
book, colour in, whatever.
Yep.
Remember, prepare children for what to expect at a hospital visit. Visits or virtual visits to the hospital and photos of a parent in hospital receiving treatment can help demystify treatment for children. Having children send a drawing or gift to a parent in hospital strengthens their feelings of inclusion. Explore why children may not want to visit hospital. Make hospital visits inclusive and not boring.